This is Dr. Dika. I'm a board-certified dermatologist. I have a practice in Burlington, Wisconsin, so it's south of Milwaukee. Been in private practice since 2021. I do a mix of medical, surgical, and kind of cosmetic dermatology. The tools that I use in the practice to treat would be medication, as well as chemical peel and even laser. So I kind of mix everything to make sure that the patient gets the best treatment. Exci came as a package deal. So I already had Aerolase device and I was gonna get the Neoderm, and then Exci came with that, but I felt like I could actually add that to my arsenal because I have some patients that have difficult to treat areas and that I can't use the regular narrowband UVB on. For instance, scalp psoriasis is one of the cases, and also vitiligo. If they only have a small area, I can't put them in a full booth to treat that. So I feel like Exci was an addition that I needed in my practice. A year ago, before I had Exci, if I had a patient again that had, let's say, scalp psoriasis or vitiligo, I would just refer them out to somebody else. But now when they come, when I discuss treatment options, I actually have Exci as one of the options available, and it's a medical treatment. So I usually tell them we're going to check their insurance for coverage, and if it's covered, depending on their benefits, we can do it. I have a patient actually who came last week with psoriasis. She had already gone somewhere else and she was getting the treatment, Exci308, but Exci treatment. But the provider was 40 minutes from her house and she lives here in town, so she's going to start coming here for her treatment, so it's more convenient for the patient. The reason I decided to get the Exci308 was, one, I already had the Aerolase Era by Aerolase and I was getting the Neoderm. I felt like I had some patients that I couldn't treat because I didn't have that device that could treat specific area or difficult to reach areas. So for instance, if somebody has psoriasis on the scalp, I can't put them in a booth to treat that psoriasis. Or if they have a small patch of alopecia areata or a small patch of vitiligo, I can't put them in the booth to treat it. So having the Exci308 helps with those conditions or with those difficult or small areas to treat. Since introducing the Exci308 to my practice, I've seen, I guess, increased revenue. And one reason is because first, it's a medical treatment, so we bill insurance, so patients don't feel like they have to pay out of pocket. So when I tell them it's not cosmetic, it's medical, so they're willing to have that treatment. And I've had good reimbursement. So I have patients that have Medicare or Medicare Advantage, and also patients that have commercial plans. And for the Exci, the reimbursement goes from, in my area, I'm not sure how much it will be in New York, but here the reimbursement goes from $144 to like $157, $160. So it's a good source of revenue. The disease states or conditions that Exci has been effective on would be psoriasis. Definitely, I have a couple of patients that I'm treating with psoriasis. I have actually a patient who came earlier this week. She had been getting the treatment elsewhere and it was helping, but it's 40 minutes from her where she lives, so she's in town, so she's going to start the treatment. Having the Exci308 in my practice, it adds something else that I can offer my patients, right? Instead of seeing a patient and saying, hey, you have this, but I can't treat you, I have to send you somewhere else. And then so it's like, oh, so I have to drive somewhere else, I wasted my time, I came all the way here. So I like to be able to offer different options to the patients, and they feel like, okay, I can come here for everything I need, I don't have to go somewhere else to get this treatment and come back to her for something else. So I like that. As far as treatment and reimbursement, one thing is with the treatment is simple. So initially the patient comes, we have to do the MED test, so where we do test pads on the patient's arm, and then they give us a result and determines what the starting dose is. And then usually before I start treating the patient, I do a prior auth to make sure that it's going to be covered and the patient knows their benefits up front. Otherwise, they don't want to be surprised with a bill. So then we bill the insurance. The code that I use is the 96920, not the 96910. That is what I use for the NB-UVB. So for the Exci308, when I do the treatment, the billing code is 96920. And like I said earlier, the reimbursement is between $140 to $160. Compared to other dermatologic devices, the Exci reimbursement is great. The good thing is I don't have to do the treatments. My staff does the treatment. So it's almost like a phototherapy booth again. The patient comes in, I have my assistant come in and kind of do the treatment. She takes some photos. If the patient has any question in particular, I come and see the patient. But after, like, let's say 10 treatments or 12 treatments, then I see the patient to evaluate the patient. So it's almost like passive income. So you're in the practice, it's a medical service, but you don't have to provide the service. Well, the Exci, as you guys see here, is a handheld device. It's very easy to use. So basically you plug it in and because the patient was already here the first time and we already established the MED dose, so you put it in, and then based on the next day, and we have a manual that tells you, do you go up or down based on the patient's response to the prior treatment session. So if the patient tells you, hey, I had a little bit of irritation, then you know that either you're going to keep the same dose or you can go down. And once you set that here, it's easy. You just hold it wherever it is, you push it down, it kind of goes off, and then you go again. It's easy. Within 5 to 10 minutes, the treatment is done. The XC treatment, again, depending on what area you're treating or how big of surface area you're treating, the setup time actually takes longer than the treatment, I would say. So the treatment itself is, again, 1, 2, 3 minutes, maximum 10 minutes. That's if the patient has like a bigger area to treat. So it's a very, very quick treatment, in and out kind of for the patient, so they don't have to wait for a long time, especially if they're not waiting for you, the dermatologist, to kind of provide the service, or the provider. So then the staff can just, a trained staff of course, can come in and do the treatment for the patient, in and out. Before I got any Aerolase device, I had a Cutea Zero, and then I got approached by Aerolase, and I was like, no, I already have a device. They're like, well, but this is more geared towards skin of color, and knowing that my practice is more skin of color patients, so patients that are darker Fitzpatrick skin type, so the skin is more sensitive, so the laser device that we use on them, has to take that into account. So, and I have a few colleagues that are already using Aerolase and they loved it, so I was like, I'm gonna give it a try, and I think it was a good decision, because not only the devices kind of deliver, but also the support that I get from the company. When it comes to Aerolase dermatology program, the team has been very responsive, so anytime I have a question, or I need to ask questions about protocol, or I need the trainer, to help me with something, I've gotten responses within 24 to 48 hours. Since I've had the device, which is almost a year now, I haven't had any issues. So the main thing with the XC is just maintenance, so yearly calibration, and that's it. There's nothing else that needs to be done. As long as the device is clean after each use, kept in the case, it's not gonna break. As far as all the I guess laser companies that I've interacted with, I would say Aerolase is, I like Aerolase the best, because again, not only do they sell laser devices, but they have a derm program, so meaning they don't only sell the devices to med spa and all that, but they also have a dedicated team to take care of the dermatologists and make sure that they listen to them and make upgrades to the device based on their feedback. So I like that, the fact that again they listen to us, and then we are kind of on the forefront of whatever they do to their devices, or whatever innovation they come up with.
My name is Deanna Doyle, and I came to Dr. Dika because I have scalp psoriasis. Initially started in my ears and kind of migrated to my scalp. I had been seeking a dermatologist in the area for my scalp psoriasis. It really kind of started to become bothersome and the area increasing in size. I was able to search out Dr. Dika. I reached out, they responded right away, and they were able to get me in right away. It wasn't a 7-month wait like most places. After that, we had been exploring previously with other dermatologists with medications. I did topicals, I did ointments. A lot of them were messy or dried out my scalp, but they also all involve steroids, which then in time thins out your skin, and it's just not good for prolonged use. I was taking Otezla. The Otezla did have side effects, and the cost was extraordinary, even with the cards that they give you to help counteract that, and my insurance, it was just far too much that I could afford. And then there was the side effects. It just left me feeling queasy and not well most of the time. So once my insurance ran out and the card ran out, I just was like, okay, I'm done with the Otezla. Dr. Dika had told me about this type of treatment. It would just be brief, and side effects, really none. So I said, let me know when you get the machine, I want to try it. I am just finishing up my 17th treatment, and through that I am no longer like huge plaque in the treated areas. I come in twice a week, usually less than 10 minutes, very quick, and they're always ready for me. And it's just a touch to the scalp, push of a button, and I'm out of here. The most, I would say, like discomfort I have felt is just like a sun-kissed feeling. So she treats like 2 areas on my scalp and both of my ears as well. My insurance does cover the treatment, And I do have a slight copay. The pill medication was thousands of dollars. I mean, this is not even $50. Treatment with the initial topicals that I had been using really just dried out my scalp. It made it more itchy, but also as soon as I didn't apply the steroid treatment, it would come back full-fledged. The scaling would increase. So then when I went to the Otezla, it actually never went away, even with that really expensive prescription. It was still scaly, still itchy. Treated the whole area twice a week, and the scaling has gone down. So now it just here is pink, but I don't have the, I guess it's like crocodile scales on my scalp that are kind of like building outward. So I no longer have that, which is a fantastic experience.